Patients in the hospital need all sorts of tests and procedures, from pathology samples to check for cancer to blood tests and transfusions. In the past, patients were given wristbands with stamped patient information or identification. These wristbands were manually checked by hospital staff to make sure the right test or procedure was being given, but there was always room for human error.
1 in 2,000 times they would have either the wrong name or the wrong blood in the tube, and you would have an error. And it's the same error rate because everybody's using a manual system. That's just what human error rate is for a sample collection, and it's very consistent hospital to hospital.
Newer, more precise barcoding systems have been increasingly used by hospitals across North America to cut the risk of patient misidentification. And Sunnybrook is now the first hospital in Canada to be rolling out a new hospital-wide barcoding system to help prevent these errors for both lab samples and blood transfusions. The new wristbands have several types of barcodes depending on the procedure needed to cross-check with the patient's ID. Staff doing the tests are also barcoded and enter a personal PIN number to keep track of who's doing the work. Labels are printed right at the point of care to stick onto blood tubes or pathology samples. Blood products are also barcoded and checked before being given. If it's not a match, an alarm goes off to notify staff.
Since we started it, over tens of thousands of samples have been barcoded with this technology, and not a single error has occurred on a barcoded sample.
702.
Other hospitals are now learning more about this system to use in their own centers of care. Dr. Callum says the old way of manually checking patient samples is the backup plan if needed, pushing this new technology to the forefront of keeping patients safe, one click at a time. With Sunnyview, I'm Matys.